This week at Madera Clinic, we rolled out a new blood test which screens for over 50 different types of cancer. Not only does it screen for these types of cancers and is very accurate, up to 88% accurate for advanced stage cancers, it is 70% accurate for early stage cancers, stage 1 and stage 2, and many cancers that we don't have any screening guidelines for right now. Pancreatic cancer, being one of the most deadly cancers of this country, has no screening right now. And this blood test is the first test that I've seen that actually can screen for pancreatic cancer. So obviously we're very excited to be offering a test like this. We are all about early detection and early aggressive treatment of any and every form of cancer so that we can possibly have a cure. That's what it's all about. That's what having a relationship with a primary care provider should be about. Early detection, aggressive treatment so that it's not negatively affecting your life or ending your life. Inevitably, we get the question, does insurance cover it? And unfortunately, it doesn't. And it begs the question why? Because it's a very good screening test. It has accuracy that rivals other screening tests for other cancers out there. So it's not that the data isn't there to support it. So why wouldn't it be covered? Unfortunately, in our healthcare system right now, we've gotten out of just taking care of patients and doing what's best for the patient. We have transitioned more into really taking care of bottom line. What is the profit? What is the cost? Cost does matter, but it should never be the decision maker for whether you do something for a patient. It should always be what's the best thing for that patient. And here's a perfect example of a test that costs $700 to do that is very accurate, and insurance doesn't cover it, and I don't think they're going to cover it. We've got medications that have been out that are great medications that drastically reduce the risk for heart attacks and strokes, and the insurance coverage is terrible for these medications. Even whenever they say they will cover it, the administrative barriers they put in place essentially make it impossible for patients to get on these life-saving medications. So not only will the insurance not cover it, which in a certain way, these companies who are providing these medications, and in this situation, these cancer screening tests, they've had to make it more affordable for the general public to be able to just purchase it from a cash pay system of just being able to afford it. So it has basically kind of kept the price reasonable. I mean, $700 is not cheap, but it also is not ludicrously expensive. Some of these pre-novo full body scans, people are paying $3,000 to $5,000 for. They're not nearly as accurate as this $700 blood test. Then the next question I get is, why are not more practices offering this type of test? The drug reps come in and talk to me about this, and they are wondering why more practices aren't adopting and offering it like we are. And the real answer is most of the practices now are owned by the insurance companies. The largest primary care clinics in this country are owned by the insurance company. So you may not realize that your doctor is employed by United Healthcare or Blue Cross Blue Shield or Aetna or Cigna or Humana, but they are. And because of that, they are never going to employ a system that they don't cover that potentially is going to increase the cost that they're going to have to pay for that year. Because insurance companies only care about year-to-year costs. They do not care about finding a cancer early and treating it before it would be a very, very expensive treatment 5 years down the road. They only view it as year-to-year cost. At the end of their fiscal year, they write off anything else and go on to their annual cost cycle analysis, not having a long-term approach of great healthcare and true value-based healthcare, which is finding cancer early before it's a catastrophe and treating it then. They would rather the cancer not be found while you're insured by them. It found while you're insured by somebody else so they don't have to pay for it. And that increases the profit margins. And that's sad because we're in a place where large system primary care offices are highly unlikely to ever offer these types of life-saving cancer screenings because of the system and the business model that they are in and employed by. But there are smaller and smaller amounts of small to medium-sized primary care practices that are owned and operated by primary care physicians. Those are the only ones that are ever going to want to offer this type of test. But we are an ever decreasing portion of primary care practices out there. I don't even know if we account for 20% anymore. I know in my network over the past 10 years, it went where the vast majority of everybody owned their own practices, and they were small practices with 1 to 4 docs, medium-sized practices with 6 to a dozen docs. Most of them were around that. The physicians were the owners, they were decision makers, and the primary reason for making any medical or any business decision was medical decisions take precedence. What's right for the patient takes precedence. That formula is not here anymore. And it's a travesty that we today have the technology and the science to be better at diagnosing cancer at an earlier stage and treating it. But the business model has been so perverted that we no longer have the financial incentive to do that. And that's where the profits of the value-based system we're in right now have led to worse outcomes. That's why ultimately the value-based system right now is suffering, because now they're at the end of a 4 to 5 year cycle where the things that they put off doing in the beginning eventually caught up to them from a cost perspective. Because delayed care, which most of the value-based insurance-based plans have really been designed around over the past decade, was trying to find ways to delay care, eventually ends up costing more in the end. And now that they're coming to the end of that business cycle, they're seeing it in their upside down profit margins and them running out of loss, and they're freaking out on what to do. Well, their specialty was delaying healthcare and impeding and obstructing healthcare. And then one of the strategies they used was, let's go buy up all the primary care practices, because now we can control from the very beginning of where care starts. We could control what we will and won't allow to happen. And we don't even have to do it in the way of denials. We can do it by not allowing the systems to actually be able to even offer it in the first place. And it's not good patient care. So offering these types of advanced cancer screenings, I love doing it at our practice. It's the right thing to do for our patients. And I'll tell you, as soon as I posted videos about it, my phone blew up of all the physicians that I know that are in their 30s and 40s and 50s that want the test done and are ready to do it. They understand the cost, but cancer's being found at earlier and earlier stages. At a younger and younger patients are being affected by more advanced cancer, especially GI cancers. And it's scary. It's very scary that we've got patients who are in their 30s, mid to late 30s, be diagnosed with stage 4 pancreatic cancer, stage 4 metastatic gastric cancer, and esophageal cancer, who had no risk factors and have their entire life ahead of them. And by the time we find out, it's really too late. And then you have a test like this that comes along and you realize, oh, I've got the tools now to use it. Why is not everybody doing this? Well, the systems have been set up to intentionally prevent something like this from becoming mainstream. So that is the health system as a whole that needs to be healed. That's what I am trying to help lead out with many other physicians as well, trying to help lead out to heal the healthcare of this country, because it is very, very sick. And now it's costing lives. I would argue that if we really dug into the data, it's not cancer and cardiovascular disease as being the number one killer amongst Americans. It's a sick healthcare system that is not prioritizing early detection and early treatment and using these advanced scientific breakthroughs to deliver better care. It has become too much about saving money at the cost of the patient. And that's not healthcare.